welcome to Cover Story. Today we're in conversation with Dr. Barnali Datta. She is a familiar face on our roundtable shows. She's been there right at the front of the COVID war, fighting on our behalf. She's the director of respiratory services at the Medanta Hospital. But today I've got Barnali here for altogether different reasons. She's come out with a debut novel. It's I have a copy of it with me, In a Better Place. And it's actually about the lives of doctors. It takes you behind the hospitals and into the struggles, the everyday struggles, our public healthcare system. The book also takes you to England, so we can compare the Indian system with the English system, and of course what every doctor goes through behind the inside the white coats is what we see, but they all have their own struggles and their own lives. So congratulations, Barnali. It's a lovely book. You've got a brilliant style, I think, of writing. It's very easy to read and totally gripping. Congratulations.
Thank you.
But before we talk about the book, I would also, apart from the book, also want to talk to you about the health of the nation. Where are we on this fight on COVID, monkeypox, etc. But first, about the book. If you could, tell our viewers a little more than what I have about what the book is about and why you decided to write it.
Sure. Thank you, Priya, for that very nice introduction. So the book is called In a Better Place. And it's, of course, an aspiration. It's aspirational. All of us want to be in this elusive better place. And, you think it's a better place. So when you get there, perhaps it's not the better place as you thought it would be. So that is what I think one of the themes is certainly. Now, I have to say that I wrote this book because I strongly feel, a doctor's life is it's fascinating in some ways. It's tough. It's very challenging, but it's fascinating nonetheless. And I always felt that, that we should write about doctors. Nobody writes about doctors, and doctors themselves are just, far too busy and too caught up in their day-to-day lives in the hospital. So that is something that I realized, as I am as well. But interestingly, I wrote the first draft of this book 12 years ago when I came back from England. And, whatever was in my head, and 6 months I wasn't working, I was settling my daughter in, etc. So that's when I just jotted down everything that was, all the memories, experiences, events, whatever I carried, whatever I thought was relevant to me, to anybody, really. I just put it all down. And then, of course, once I joined work, it all went into cold storage, and I didn't have time to even, look at it. Although
before you talk about the writing the book, can you tell us what the book is about? Because,
Sure. Yeah. So the book traces the journey of 3 doctors from, at the turn of the millennium, turn of the century. Now, so 1999, 2000, 3 doctors. So if you remember, that was a much easier time, a simpler time. There was, digitization hadn't taken place. We were still doing letters, and, there was no email, there was no internet, etc. And the 3 doctors, and it just shows us what a doctor faces, because you want to improve your skills, you want to earn well, you want to have a good livelihood, etc. And then some of them, migrate to the West, as many do. And then their experiences through England, 2 of them at least, and the other one is kind of determined to be here in India and serve the nation, serve the country, do medicine for those who don't have access, to address the problems of health inequity, etc. So he stays on the challenges he faces and how he eventually almost doesn't have a choice but to leave and go west to improve his earnings, improve the life of his family. The ones who go abroad, professionally they thrive. But there's so much else to living in the society there. For some, it is quite, they accept it because they accept it for different reasons. For some, it's not good. They want to come back. And of course, they all miss their home terribly. So it's that angst of the life there, how you're trying to settle in, and then your home calls you back and you want to go back, and then you're torn essentially between this thing of wanting to do the best for yourself and for your family, for your professional satisfaction, and of course the much more emotional, the thing that comes from your heart that calls you back, draws you back to what is home and what can never be otherwise. So it kind of just maps that.
These are the compromises I think every profession makes when you go abroad versus working at home. But the lives of doctors have come under a lot of focus, and prominence because of COVID. We all have had you on television shows. You all want to know what you're, all about, your own private struggles, your lives, and for instance, you also an author. But this is what I like about the book, is that it takes you behind the scenes. You get to know what the doctors face. For instance, as you talked about the public healthcare system, then the whole decision: do you earn more and go abroad, or do you earn less and stay back? And what are the opportunities and options in the medical profession that are there? And of course, what I think everybody faces, there are little nuances which I liked. For instance, when you go abroad, we all tend to say, like you wrote, today morning instead of this morning. Then you yearn for that aloo ka parantha instead of that black pudding for breakfast, or whatever you're given over there. So there are a whole lot of things that come out, which I think will touch a chord in everyone who's whether of the medical profession or not. It's a novel. It's also, you can read it just for the storytelling also, I would say.
Sure. I'm glad you feel that.
But a bit about yourself before we talk about your book. You said that you wrote it while you were in England. So you obviously went through your early years in England.
Yeah, so I trained entirely in Delhi. I was in Maulana Azad Medical College through my medical schooling and MD medicine post-graduation. And then I left for England. I was there for a decade and I did my pulmonary training there. And then I came back 2010. So it is definitely a kind of map of those years and the comings and goings and everything that goes on. And I think inherently, I mean, writing is something, when we grew up, we just had books and and all our thoughts and imagination, fantasies, everything was kind of developed by books, because there was no hardly any TV, nothing at all in the digital space. And so we just read, and that I think translated to writing. And yes, I wrote I think in England, whatever struck me, because I was very young at that time. I was 28 when I reached England, and I was roughly 38 when I came back. And 12 years down the line, I mean, I don't want to disclose my age, but it's quite obvious what it is. It's a milestone year, and I'm a different version of myself now. And I finally completed it now when I'm a much more mature kind of self. But at that time, whatever struck me, I kind of jotted it down, and then I elaborated on it and made it.
What we call a reporter's notebook to fall back on.
Right.
Okay, so a bit, about the public healthcare system. That's what you also talk about, and that's come up in India. During COVID, the inadequacies of it have really come up. So, what if you can tell us something about what can be done and the state of the system in India over here, compare it to what happens in London, for instance.
Yeah. So I think, I mean, the systems are very different. So England, of course, has a, national health system, as we know, the NHS, and you get healthcare free at the point of care. And that's a big thing for any individual. So, of course, you pay for your entire working life. It's like an insurance, but you're paying it into the national healthcare system. Now, there are pluses and minuses, of course. For emergency care, I think it's the best system you can be in, because you reach emergency, they will look after it. However, if you have chronic disease, people who need, for example, knee replacements and things like that, that is obviously low on the priority, and you have to wait your turn. There is no way you can expedite it unless you take private healthcare insurance and go the other way. Now, so there are challenges, but the one thing that I used to really think was amazing was that anybody could come to hospital and get the best care possible. And of course, the other side is that you may have some chronic disease, you may have to wait. Now, they have an excellent primary healthcare system. They have GPs available, etc. But again, getting appointments, I mean, you have to navigate the system. It's not easy. They do try, and they try to give, health equity is a very big thing for them. That means whatever your earnings, whatever your status in society, you will get the same healthcare regardless. Now, in India, I think we have a fantastic healthcare system if you can afford it. Private hospitals have come in a big way in the last 10 years, and they have good doctors, good healthcare, but you have to be able to afford it. And what percent can afford it? Very, very, very less, really. Health insurance is now started in India. So a lot of people pay out of pocket, and that causes what we call, the catastrophic kind of, impoverishment and things like that. And almost we have 70% of people who live in the rural sector, where the government has certainly tried to put primary healthcare, secondary healthcare in that, but and again, in all fairness, the government has tried to eradicate or deal with the key big diseases like vaccination for infectious diseases, tuberculosis, which we deal with a lot, and now there's non-communicable diseases, the diabetes, heart disease, etc. So they've tried, but again, one of the deterrents is the fact that we have a vast population. We're going to cross China next year, which is really, really very daunting, very tough for us to keep up with that kind of thing. But again, our health budget is not enough, is simply not enough. And much, much more needs to be done because, to say that our population is too big and therefore we can't deal with this is not good enough. As a country, we just have to devise ways and means to either control the population. And if you can't, then you have to cater to the needs of the population. So I think a lot more needs doing. I mean, of course, it all boils down to the budget and how much you're, willing to give to healthcare. And I think the health of the nation is a key thing. COVID completely unmasked all our inadequacies. And again, the government did try to do a lot. Private sector did a lot. Everybody kind of joined into this battle against COVID. But then again, now COVID's, taken a back step and we will just go back to our old systems the way we were.
Okay. On that note, I wanted to, also have a chat with you on the health of the nation, so to speak. A couple of things. Where are we on COVID? Because we are still seeing cases rising. So is it big? It's not as fatal as it was earlier, not as, serious. That is why we can afford to take a little bit of a sigh of relief. Where do we stand on COVID?
Yeah, no, absolutely. So I think since the beginning of this year, when Omicron started with a bang, I think we realized that it is a much milder disease, which doesn't go through to the lower respiratory tract and the lungs. It's all in the upper respiratory tract. It does cause a lot of sore throat and body ache, fever, etc. And that is what we are seeing even now. Yes, there is a little spike in cases, but I think everybody's reluctant to call it another wave because it is still subvariants of the Omicron that is going on. And this is in fact endemicity. This is endemicity that it will, there will be little blips every now and again, and we have to deal with it. Yes, we have had some hospital admissions, nothing compared to what we faced the last 2 years, but there is some, but it is by and large mild. Now, this will happen. And of course, some of these subvariants demonstrate what is called immune evasion or immune escape, wherein even if you're vaccinated, even if you've had the infection, the virus is mutating continuously, and it's trying to find ways and means to survive in the human body. And therefore, that's what it does. It just a little tweak and it can escape the vaccine that you've already taken. Now, of course, across the world, there's the same situation. And England is one of the first countries that they are going to give a bivalent vaccine along with the flu jab in September, which is the standard is flu vaccine pre-winter. So they're going to add the COVID vaccine apart from the booster and all that. So it may become an annual event, which is what we were anticipating. So yes, we are not terribly worried. Safe practices have to continue always. That equally, endemicity, herd immunity comes with, people just carrying on with their lives, even though it is there. Of course, 5-day isolation, 7-day isolation remains the norm. There is no quarantine of exposed individuals because, as we discovered in Omicron, if you do that, then, half the nation will have to be in quarantine. So there's no point of that. Life has to go on and, everything has to come back to normal. So that's where we are at the moment.
I'm going to take a break and come back and continue this discussion. I also want to know what's happening with monkeypox and, more importantly, long COVID, because I think that is something that most of us seem to be suffering from. So after a quick break. Hello and welcome back to Cover Story. We are in conversation with Dr. Barnali Datta. She's Director Respiratory Care at Vedanta Hospital. But we're also talking to her about her book, her debut novel that has come out, In a Better Place. I have a copy of it. And I must say, it's a very fascinating read for someone who wants to just read a good book or know more about the lives of doctors and the challenges they face. But back to the topic that we were discussing, Barnali, long COVID is something I'm seeing even in children. We are hearing that there are kids suffering the symptoms. What are the symptoms and what do you suggest that one should do?
Yeah. So long COVID is something we've dealt with now ever since the onset of COVID. And as you know, that while it is more prevalent in those who have had a severe version of COVID, but also can be seen in anyone, really, even people who've had mild COVID. Although the categories who tend to have more is those who who have had severe COVID, the ones who've had underlying, who already have underlying illnesses, ones who've not been vaccinated. And then, especially in children, but also in adults, there's this entity called multi-system inflammatory syndrome. So it's called MISA in adults and MISC in children. So these are the categories that we've seen can go on up to 6 months and even perhaps years. So definitely in the first 1 to 3 months, we have seen many people come back who are recovering, and they have the fatigue, tiredness, inability to go back to their baseline level of activity is probably the main thing that we see, that they just de-energize. They have no energy to do anything. And these are fairly active people, young people as well. And then there is a combination of, for example, neurological, people, there is a lot of anxiety, depression with it. People have pins and needles, neuropathic, and then respiratory, breathing. That's a big thing. And people go into this vicious cycle because they can't breathe that well. Their activity levels come down, and then they get very deconditioned and they struggle to be active again for that. So it's kind of this mix of things. Now, I think there is no medication. Now, one of the hypotheses is that it's kind of an autoimmune illness that is unfolding in front of us, and low dose steroids and things have been given, but really not recommended. And I think this is one of those conditions where medicines may not be of that much help, and trying to slowly nudge yourself into a good lifestyle, increase your exercise capacity in a graded manner, little by little. That is an important thing. Have a good, healthy diet. If you do feel that you're depressed or anxious, seek medical advice. For a short period of time, taking medication to get over this is a perfectly acceptable thing to do. So I think you have to recognize what you're feeling. You have to seek medical help. And from your own side, you have to focus on your lifestyle and just try and slowly come out of it. May take a few months, may take 6 months, may take a year even. But, gradually and eventually you will, come out of it.
That is reassuring to hear, and from someone who knows, who's been there, who's really there at the front line for battling this for us. Where are we on monkeypox? Because we heard about, I think by August there were 8 cases, I think 1 death, but so far that seems to be it. Is that a cause for worry?
Yeah, no, absolutely. So I think again, it's an infection. We need to be very aware and very vigilant. But, to be honest, we haven't dealt with it yet as a clinician. I haven't encountered it at all. Our hospital hasn't encountered it at all. We sometimes get an alarm that, there's someone in emergency with a rash. And then when you see the patient, it's mosquito bite or it's something else. So we've not yet faced it in a real world situation. But yes, we know it's there. And I think vigilance and like a surveillance has to carry on over the next several months to see what happens to it. And hopefully we'll be able to tackle it.
COVID and all the pandemic aside, what are the healthcare illnesses that you encounter most in Indians that we are most susceptible to, that we take lightly? I mean, cancer, of course, has now become such a dreaded word. I think that everybody's aware that you have to do these periodic checkups, etc. But what are the other illnesses that we are neglecting and that we should be focusing on?
Yeah, so India as a nation, communicable diseases or infectious diseases was the biggie for us for a very long time. And especially respiratory related tuberculosis was a big thing. Malaria, dengue, seasonally would always be a problem. And then other things, viral illnesses like influenza and all, are things that we can deal with. Now the trend has changed significantly, and non-communicable diseases or NCDs have become a very big thing. So, for example, diabetes, which is related to obesity, cardiac disease in very young people, hypertension, and then we have COPD, obstructive airway disease because of smoking, tobacco chewing, etc. These are things. In cancers, yes, you're right. I mean, breast cancer has really skyrocketed. Now, whether that is because our diagnostics, our awareness has just become much better and people are coming for regular health checks, maybe the reason that we are picking it up much more. Lung cancer was always a big thing. Bowel cancers is a big thing. So yes, I think regular checkup, without being fanatic about it, but I think regular checkup after a certain point in time, for example, after the age of 50, it is recommended that you get your breast check mammograms done for women once every 2 years. Bowel, if there is a history of bowel cancer in the family, or in the West, they want you to do a colonoscopy once every 5 years. Now, obviously, we don't do that, but at least some awareness that, look, if your bowel habits change, then you must seek healthcare advice. If you're coughing away for 2-3 weeks unexplained, you don't have allergy, and you have smoked in the past, must seek healthcare advice. So the only thing I think is to lead a healthy life as far as possible, work, but don't get stressed by it. Don't take too much stress on it. And very important is also don't neglect, symptoms which are there. If you have symptoms which are of any concern, then you must seek healthcare advice, must get the, required checks done. I think that's important without letting it take over your life.
That's true also. But post-COVID, do you see a lot of awareness on mental health? Or is, as you said, don't be afraid to seek help. Are more and more people coming out and admitting that they need help?
I think so. I think they are, but I think there's still a lot of stigma to be overcome still. And we always, all the COVID patients, sometimes you see a COVID patient, you'll say, what's your mood like? When they're saying we have no energy. And some of them break down in clinic and, they start weeping even. And obviously they are aware that there is something wrong, but they are, scared to come out with it. So I think while the acceptance is much better, our psychiatry colleagues have, they have big follow-ups. They see a lot of patients. So while that is there, but I think we have a long way to go still for people to accept that, look, it's perfectly natural for anyone in the course of their lives to have these ups and downs. And instead of, being in denial and not taking any advice or any medication or any help like counseling or, therapy, just come out of that and do what's needed for you to recover. I think that's important.
What about geriatric care? Is that an area which I think now maybe people are becoming more aware? For instance, they even talk of old age homes, looking after the old. But in terms of a specialization, I see very few doctors that just, do we need a GP for geriatrics, so to speak?
Yeah, no, absolutely right. And England had a specialty, have a specialty called geriatric medicine or care of the elderly, they used to say, because, care of the elderly is more appropriate because for the elderly, it's not just medical problems. There are so many other things, little things that need to be looked after. So yes, you're right. We don't have a specialty called geriatric medicine, and our doctors of internal medicine, deal with that. We deal with that, whoever we come across deal with that. But we do need a specialty called geriatric medicine because their needs are very different. Just like for children, they say a child is not a little adult. It's a totally different specialty. In a similar manner, while an internal medicine or a physician like myself can address most of the needs of a elderly person who has a medical problem. But yes, they have certain things like mental health is a very big thing. This time through COVID, mental health got unmasked big time, as we know. Youngsters, children, adolescents, teenagers, everybody. Adults, of course, adults are sometimes kind of bear the brunt of it a bit easier, but adults are there. And then elderly. The elderly, it was, we saw things like depression, dementia, everything accelerating so much in these 2 years of lockdown when, our lives became abnormal. The natural social interactions, everything went for a toss and you just isolated, locked into a house, into a room. And I think that had terrible.
Thank you, Barnali, for this conversation. And as I was saying, it's a book that we must all enjoy. And before I let you go, one last question. Is there a bit of Sudha in you? Are you also an avid reader of Harry Potter? And, you did do the stint in England and back.
Yeah, no, that's a good question. I think there is a bit of Sudha in me, a bit of Sanjay in me, probably a bit of Jay in me. Yeah, all of them. And, so many of the doctors who've read it have said exactly that. We identify with each one of them at different times of our life, at different, situations. And so, yeah, I think that's every doctor relates to it. So that's quite heartening for me to know.
Well, once again, congratulations and thank you so much for this conversation, and wish you all the best with this book and waiting for your next one. Thank you.
Very much, Priya. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.